Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Enugu government asked the elderly and those living with underlying illnesses to get vaccinated. Edo government insists on no vaccination card, no entry enforcement despite reduction in COVID-19 cases. And Sydney's cafes, gyms, restaurants welcomes back fully vaccinated customers after nearly 4 months of lockdown. Last night, Nigeria's daily case count reduced, with the Nigeria Center for Disease Control reporting 78 new coronavirus infections recorded in 10 states and the Federal Capital Territory. A multi-sectoral National Emergency Operations Center, EOC, remains activated at level 2 as it continues to coordinate the national response activities. The breakdown by the NCDC shows Lagos recorded the most infections with 22 new cases, followed by Kaduna and the FCT with 12 and 10 infections respectively. Kogi State remains the only state in Nigeria without a case on admission, and the state has not recorded any confirmed case in weeks. However, Yobe, Katsina states are managing 3 cases each, and the highest is Lagos, with over 4,000 cases on admission. Let's take a look at the breakdown.
Objects such as light switches, doorknobs, tabletops, and other frequently touched surfaces have a high potential of carrying the COVID-19 virus. The NCDC is recommending that people should clean and disinfect surfaces regularly to minimize the risk of contracting the virus and other infectious diseases. 78 additional persons in Nigeria have tested positive in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 10 states and the FCT, a decrease from the figures reported earlier. Lagos logged the highest infections with 22 cases, followed by Kaduna with 12, while FCT came in third with 10 infections. 9 cases were recorded in Benue. Imo had 8, Akwa Ibom, Delta, and Kanu recorded 4 each. Jigawa had 3, while Plateau and Rivers logged 1 case each. Bauchi, Nasarawa, and Sokoto states did not report any case. The overall count of confirmed cases in Nigeria now stands at 207,694. 142 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 195,274. With more than 4,000 infections, Lagos is leading the chart of states with the highest number of cases currently on admission, followed by the FCT, Delta, Edo, and Oyo. 2 patients have died from complications in the last 24 hours, raising the fatality toll to 2,747. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested. More than 5 million eligible Nigerians targeted for vaccination have been reached with the first dose, while over 2.3 million persons have been fully vaccinated so far. In Africa, there are more than 8.3 million confirmed cases and over 214,000 deaths recorded across countries on the continent. The total global confirmed cases have surpassed 237 million, while deaths are now beyond 4.8 million.
The Enugu state government has called on the elderly and those living with underlying health conditions to avail themselves of the COVID-19 vaccines. Briefing journalists, the executive secretary of Enugu State Primary Health Care Agency said the government has begun a campaign for the elderly, taking it to their homes, churches, markets. According to him, the vaccine is safe and does not shorten lives, contrary to theories on the streets.
The Primary Health Care Development Agency in Enugu State has a structure. It is a well-organized system. We have our local government health educators, we have our local government, we have our ward town announcers and all that. They are all in the streets, all in nooks and cranny, talking about this vaccination program. We started from that first phase to emphasize that people who have underlying illnesses should come out and be vaccinated. And we went all out to look out even for the elderly. From this agency, we visited the old people's home and encouraged people to bring out their elderly. And in any way we are vaccinating, once we see an elderly person, we finish vaccinating him or her to go home and rest before those who are younger who can wait for a longer period. So even in this second phase, we are still re-emphasizing and talking about those who are elderly, and those who have underlying illnesses. The reason is that this category of individuals are more likely to succumb with the illnesses should they catch it. So it's very important that they are protected.
Meanwhile, over in Edo State, the government says its COVID-19 vaccination cards enforcement as a requirement to access government facilities will not stop anytime soon, in spite of the reducing number of positive cases in the state. The head risk communication pillar of the Edo State COVID-19 response team, who was speaking to Channels Television in Benin City, says the state government is not willing to take chances, even with the successes recorded so far. He advises residents to still observe the laid down non-pharmaceutical protocols to ensure the figures continue to go down.
In the past couple of days, we have seen some decline in number of cases and deaths, but we're still very careful and cautious. We still encourage citizens to follow the guidelines very carefully to prevent a spike, because it's a very infectious disease. When if you don't manage the protocol carefully, then there can be an unexpected spike. So that's what we're working on. We believe that the silver bullet for dealing with this pandemic is vaccination, and we're not going to let off. So we're going to continue to insist that our citizens are vaccinated, even though it's not compulsory, and we're going to use every method that is legal and that is humane to ensure that we encourage our people to protect themselves against this disease. Yeah, we have traffic, not as good as we want. We want more and more people to continue to come and get vaccinated. We have stock. We have not less than 50,000 doses of vaccine in stock, so anybody who's interested in taking a shot today will get. But however, we still keep looking out for more vaccines to come in to ensure that the full population of the state that is eligible for these vaccines will get when they're ready to take.
And there are signs that travel has resumed in earnest, despite pleadings from the country's Centers for Disease Control and Prevention to stay put. Even though the cases around the world stand at over 237 million and deaths edge close to 5 million, the recommendation largely is that fully vaccinated individuals refrain from non-essential travel. But even at that, as more people get vaccinated and travel ticks upward, there are questions about how to prove inoculation, including the so-called vaccine passport. To put things into perspective on the viability and safety of international travels and the vaccines, joining us is Dr. Nsebasi Akanim, is also a pharmacist, a public health practitioner. We'd like to thank you for joining us in the studio.
Thank you for having me.
I'd like to begin looking at the optic of international travel. Since countries started vaccinating their population, is it safe to travel?
Well, for those who have been vaccinated, to an extent it's safe to travel, but then traveling to some of those countries that are still hotspots is really not advisable, especially for non-essential activities. If it is something that is absolutely important, that is not something that can be done virtually, well, it might be permitted, but as much as possible, we are encouraging more people to engage in virtual activities. If you are going for probably a meeting, a conference or something, you can do that virtually, at least for now, particularly for those countries like Brazil, South Africa, Turkey, India, and the rest of them. It's important that we limit travel to just absolutely essential, functions or essential duties, so that we can help protect ourselves. Because, we keep saying that taking COVID-19 vaccine does not protect a person absolutely from getting infected. The only thing it can do is to reduce the chances of developing severe, symptoms or complications. So if one is fully vaccinated, it doesn't mean that you cannot get infected, and that's why we need to avoid anything that will increase our risk of, contracting the vaccine.
What's your take on the COVID-19 vaccination or COVID-19 passports?
Well, COVID-19 vaccination, yes, is an interesting thing, and as much as possible, I encourage countries that have had access to enough doses of COVID-19 vaccine to encourage their people. And one way they can do that is to ensure that people present their their COVID-19 vaccination cards. To an extent, it shows us that there's a lesser risk of transmitting the infection to other people who are susceptible. But for countries like the sub-Saharan Africa, that we know that access to vaccine has been quite poor. I mean, implementing such would be it would not be fair at all, because there are some people in Nigeria who would probably love to take the vaccine, but because of the supply side challenges, they may not have access to the vaccine. So if you want to enforce it now, the vaccine card or the vaccine certification, it might just be going overboard. So I think until we get to that point whereby we have access to enough doses of COVID-19 vaccine, we can then be sure that anyone that has not taken the vaccine is just blatantly refuses to take the vaccine. But for now, we have not gotten to that point yet.
So you don't think we should have a sort of, or require vaccine certification in country, but for us traveling out?
For those traveling out, I think it's necessary, because globally it's becoming an acceptable norm that you have to provide that, and it is in line with global best practice. It's what is expected, because we, as much as possible, we don't want people to export or import new variant of the virus. So that's why it's necessary that people who are traveling outside Nigeria, endeavor to take the vaccine so that they can receive their cards. And that is why I want to also say here that people should desist from racketeering. I mean, going to pick up a vaccine card without taking the shot, you're not doing anybody any good. You're not doing yourself any good either. So you go, if you need to travel, and it's quite essential, go and receive the shot. It's available in all the primary healthcare center, even the one nearest to you. So you go there, take the shot, get the card, and then travel. But for those in Nigeria who may not be able to access the vaccine, perhaps due to the fact that we don't have enough doses, I just feel that we should probably ease on those ones.
Only today in Wales, there is the NHS COVID passes, and they're now compulsory to attend big events or even go to the nightclub. So what's your take on having such a passport system for as little as going to restaurants to eat?
Okay. Well, I would say this for now. Because we have not gotten to that level where we can actually enforce. You see, when you're talking about enforcement in open places and places like nightclubs, like restaurants and all of that, then as much as possible, you have to ensure that there's vaccine for people who are interested in going there. But because we have not gone there, that's why we keep encouraging Nigerians to please avoid crowded places. Avoid places that would increase your risk. Since we may not, as a country, be able to enforce and ban people who have not taken the vaccine, we are encouraging as much people as possible, okay, please go take the vaccine for those who can access the vaccine. And those who cannot access the vaccine, please avoid these places. Public places, places that are overcrowded, places where there's no proper ventilation, please avoid those places. And then, in addition to that, still adhere to the public health measures. And that even applies to everybody, whether you are vaccinated or not. You need to adhere to these public measures, because you can actually get infected if you're exposed to the virus.
2 days ago, 137 cases. Just last night, 78 cases. It looks like the curve is coming down.
Yeah, definitely. It is. And I want us to, as much as possible, we should consolidate on what we have achieved so far. From my observation, going to the field, I've seen that more people are coming out to take the vaccine. And I want to encourage that. I don't believe in forcing people. I believe that we need to communicate more with the people. We need to educate people more about the efficacy of the vaccine, the need to take the vaccine, and of course the safety of the vaccine. And as much as possible, we need to be able to manage the infodemic nature of this pandemic. As much as possible, we need to let people know that some of the misconceptions they are listening to, they are hearing, is absolutely not true. For example, somebody says you want to turn to a goat, you want to turn to a cow. A vaccine itself does not last more than 6 months in the human body. What lasts more are the antibodies that have been developed against the vaccine. That is what could last for a lifetime. So people should disabuse their mind of any adverse effect about the vaccine. Yes, there may be some adverse effect, but I am saying this, that the vaccine is very safe.
All right.
So Nigerians should go out there, get the vaccine, receive their vaccine card, and be ready to present that card whenever they travel or wherever it is necessary.
We appreciate your perspective on this issue. Thank you so much, Dr. Nsebasi Ekanem, public health practitioner and pharmacist. Thank you for joining us on the program.
Thank you for having me.
Well, still to come on the program, in Zamfara State, you see a civil society activist who is saying that the state needs more vaccines. Please stay with us. Welcome back. A civil society activist, Musa Omar, who has been monitoring the administration of vaccines in the state, is decrying the paucity of COVID-19 vaccines in light of residents' response and the population of the state. He's calling on government to ensure the availability of vaccines for herd immunity to be achieved. According to him, Zamfara State, with a population of over 9 million, received over 63,000 AstraZeneca doses and later more than 65,000 doses of the Moderna COVID-19 vaccine.
In terms of community mobilization, we roll out different strategy of engagement that is going through the traditional leaders, the religious leaders, community change agents, influencers, community volunteers to see that we create much awareness on COVID-19 vaccine and other protocols. And as I'm telling you, we have a lot of success were recorded. And even most of those that have that believe that it has its own bad side of it. Most of them has dropped their argument. In terms of enlightenment, there is much awareness, but rather what we are facing at the moment is shortage of the vaccine. Because if you look at the population of Zamfara, then how many doses did we receive to the state? Of which definitely even those who are even clamoring to receive the vaccine now, there's shortage of that vaccine. And we don't really know, maybe it's because it's something new. That's why it's coming on batch by batch. Unlike the other vaccine program, that is the polio eradication, that you see that we have a lot at hand to give. So definitely my saying is to ensure government to ensure that there is availability of this vaccine for every citizen, especially those who are eligible to take the vaccine. And as well, the community mobilization will continue because each and every day it is new strategy, new mobilization, and engaging different stakeholders to see that we see the impact of the program.
And Kwara State has been described as one of the states that has recorded a higher vaccination rate with minimal side effects from the exercise. The State Executive Secretary of the Primary Healthcare Development Agency stated this during the public vaccination exercise at the Ministry of Health.
The Kwara State Ministry of Health, where the State Primary Healthcare Development Agency is located, is one of the approved vaccination centers in the state. Residents troop in to be registered and get vaccinated against COVID-19. Earlier, the state received over 102,000 doses of the Moderna brand of vaccine and 90,000 doses of the AstraZeneca brand of vaccines, with 52,000 persons already vaccinated so far in the second phase of the exercise. The Executive Secretary of the State Primary Healthcare Development Agency allays the fears of those still skeptical about getting vaccinated, assuring them of the safety of the vaccines.
The vaccines have been found to be safe and efficacious against COVID. And with the third wave, that have been reported across several countries, one of our sure bets to prevent the disease is to have being vaccinated with the free and efficacious vaccine, alongside other non-pharmaceutical intervention, like the use of face masks and etc.
Some of the persons who have received the vaccines believe that the exercise is very important. They also share their experiences.
Well, I will implore everybody to come and take the vaccine. Prevention is better than cure, and that to play safe it's better to take it and remain safe.
As the vaccination drive in the state continues, the message on adherence to non-pharmaceutical measures in order to reduce the transmission of the virus remains key.
Away from Nigeria, India has reported a total of over 18,000 new COVID-19 cases in the last 24 hours, the lowest in over 7 months. According to the Union Health Ministry, the national COVID-19 recovery rate was recorded at 98%, highest since March 2020, with over 21,000 recoveries in the last 24 hours. And the country's cumulative vaccination coverage has crossed 94.70 crore. That's 947 million. Joining us, Harish Obdaya is a journalist, and he joins us from Bangalore in India. Thank you for joining us on the program.
Thank you.
Harish, it seems India is set to reach a milestone in its vaccination drive in the next few days. How is government achieving this?
Well, India is almost vaccinating anywhere around 70 lakh to 80 lakh. That's around 7 to 8 million doses every day. And there are days when it's given all the more push. And there are days when we have crossed 10 million, when we have crossed 1 crore doses in one single day. Now, India wants to cross this 100 crore figure anywhere in the next 5 to 6 days, because let's remember, they want to inoculate the whole population by the end of the year, by end of December, which means they will have to consistently do more than 10 million doses every day. The significant factor here is that the whole health system has gone in a very active mode to ensure that the vaccination is given in the nook and corners of the country. Drones are being used. Despite floods in several parts of the country, we've seen health workers risking their lives to go ahead and vaccinate people. Not just that, the significant factor here is that after the initial criticism that the government faced for not having enough planning for vaccination, not placing orders, India is managing this 100 crore vaccination figure, which it will in the next few days, largely using vaccines that have been produced here in India, the bulk of it being done by the Serum Institute of India, which is producing the vaccines, the AstraZeneca vaccine, which is called Covishield here, and another small fraction of it coming from the Bharat Biotech. So it's a huge achievement for India, but also there are challenges. Let's remember, they need to ensure that every day they have to give more than 1 crore doses. If they have to ensure that the entire country is vaccinated by the end of December, that's the target that the country has. And they will have to ensure that they double the number in the coming few days. But there are challenges. India is right now looking at giving permission for the Zydus Cadila vaccine for children between the age of 12 to 18. That's something that's under consideration. Regulatory approvals are yet to come by, but that will be the next significant step in this world's biggest vaccination drive that India is currently carrying on.
That's rather interesting. Harish, for a country that has many religious festivals as well, how has compliance been since authorities placed sort of restrictions on major festivals due to virus concerns?
Yes, that's a challenge that India is staring. As far as the acceptance of vaccine in rural areas, we've seen extensive campaigns coming out. The Prime Minister and the leadership, the local leadership, state level leadership, all of them coming out and encouraging people to take this vaccine. There's a minuscule minority of population that still is hesitant about taking this vaccine. That will be the challenge to ensure that the whole population is covered by the end of December. As far as festivities are concerned, perhaps second year in the running, we've seen restrictions imposed on crowd gathering, on ensuring that large part of these public events are virtually held. People get access to them virtually, and there is no footfall at the event per se. But still, we are going through a major festive season in India right now. The Dasara, the Navaratri is there. And this is one time where you will see a large public gathering happening across the country, whether it's cities or rural areas. That's the challenge. A latest survey done by a private agency says that the social distancing norms that are followed is only around 6%. The mask compliance, wearing of masks, is only around 13%. This is something that worries the government because there is a prediction of a third wave. Everyone feels it could be around the corner. There's a prediction that it could hit the children more than anyone else. And India wants to vaccinate everyone by then because India currently has vaccine. The population that has got 2 doses of vaccine is only around, say, 26 crores. So we haven't completely vaccinated the whole population. And before that, we want to ensure that there is no step down here in terms of following social distancing norms or in fact even following the mask rule. So the government is making very sure that people are aware that the next 3 months are going to be very crucial before India vaccinates its whole population.
Thanks a lot. Harish Abdaya, a journalist joining us from Bangalore, India. Thanks for joining us.
Thank you.
And people in Australia's largest city of Sydney are celebrating the end of its coronavirus lockdown, which lasted almost 4 months. As early as midnight today, people queued for pubs and shops that were open, while others have been enjoying anticipated reunions with relatives and friends.
Life is back in full swing in Sydney, as many public places which had been closed up over the last 4 months opened up to clients today. Gyms, pubs, even departmental stores threw their doors wide open. New South Wales State Premier Dominic Perrottet called it Freedom Day, telling reporters the state is leading the nation out of the pandemic, though he acknowledged the issue was not over.
No more lockdowns. It's just so taxing and so hard to deal with. I hope that we can deal with whatever happens now moving forward. Looking at the rest of the world, hopefully we can stay open and do our thing.
On a wider scale, the UN and non-aligned movements say more vaccines and climate help are needed for poorer nations. In the meantime, the World Health Organization says global COVID-19 cases has exceeded 236.5 million, with the death toll hitting 4.83 million as of Friday.
Continue to take responsibility. You can visit our website. It's channelstv.com. You can find the latest breaking news and also a better understanding of the pandemic. It's at your fingertips. Thank you for watching. I'm Millicent Walker. Stay safe.